While public health faces enormous cuts, the global wellness economy reached a record $6 trillion and is projected to climb to nearly 10 trillion by 2029. That's serious money. But wellness culture has a dark side, and it's costing people their health, their money, and sometimes their lives. In this episode of Care Talk, Jen Bordenick from Unbiased Science breaks down the grifters, gurus, and fake cures flooding the wellness industry. We're talking about how misinformation spreads, who's profiting off it, and how to spot a scam before it costs you. Welcome to Care Talk Live, a weekly American healthcare policy show and podcast where we explain how healthcare works or doesn't work and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Be sure to subscribe to my channel or podcasts wherever you get your podcasts to get future Care Talk shows. If you've ever felt confused by conflicting health advice online and not sure who to listen to or who to trust for medically accurate information, this episode is for you. Jen Bordenick is the Chief Strategy Officer at Unbiased Science. Welcome.
Can you hear me okay?
Yes.
Oh, great.
Welcome.
Perfect. So happy to be here.
So let's start with talking about what is the wellness industry and how do they make their profits? Tell us more.
Well, first of all, I'm glad that you gave us kind of that intro there because wellness is an industry and it's making over 6 trillion right now. It's a huge industry. We hear a lot of complaints about big pharma, and I like to think of it as big pharma, and then there's big wellness, which is just as big. And when I think of wellness, I just want, before we get into any of this, I want people to know I'm a huge promoter and proponent of wellness. I believe in sleep, stress management, vitamins, anything that has legitimate evidence backing it. So in my mind, legit wellness is that has scientific evidence that proves that it works. The problem is that there are a lot of wellness influencers and products out there. There are people pushing false claims, detoxes, all sorts of supplements where there is no evidence. And that's where I think we get into this gray area that people need to be careful of.
So I think one of the issues is that there's a lot of, well, first of all, it is expensive for many people to see a doctor if they even have a doctor.
Yeah.
And especially women or younger people, a lot of people may have trouble getting their doctor to take them and their issues seriously, as opposed, if in our American healthcare system, where even doctors are time pressed, they have to meet their quotas and you're in and out. They don't have the time to be able to listen to your issues and help you figure out what's going on and how to feel better. So there's this need that's not being met by our healthcare system, and specifically things that our healthcare system is not great on, like nutrition or things like exercise, food, things like perimenopause and menopause, issues that are doctors are undertrained on, don't have the experience to help you. There's this need and people aren't getting that need. And so they're turning to the internet for help. And that's where people, well-meaning or not, are making a buck off of providing
and you're running
advice.
Yeah. And, there are definitely legitimate and credible people on the internet. There are wonderful OBGYNs, there are wonderful physicians and researchers who are giving really valid and important information to women and men and families across the US. So I don't want to broad brush this. But there is this kind of influencer economy, individual creators, basically, who don't have any medical training, who are presenting themselves as authorities. And they've figured out the algorithm, and they are there to welcome you and welcome your bucks, your purses, to take really advantage of you, I think, in many cases, and offering solutions that don't really have any evidence that prove that they work. And it's very easy to do right now, I think, in this, environment that we live in, where there's a lot of mistrust of institutions. I mean, it's not just that healthcare is not as accessible as we would like it to be, but there's mistrust of a lot of different types of clinicians, of pharmaceutical organizations, and wellness influencers are filling that gap, right? They are there with the easy solution. They have one. They have figured out, they're great salesmen, right? Fear sells, and they have figured out how to sell to people that are worried. I mean, that are looking for an easy solution, a cheaper solution. You know, I'm a mom. I worry. I have lots of guilt and concern. Am I giving my kids the right thing? And, you know, this is an industry that is out there welcoming those folks within their arms and giving them easy answers and easy solutions.
And I think to some degree, women have been taught almost since birth that there are things about yourself that you need to fix, and there's
Yes.
makeup and so on that is providing pseudo-scientific information to you that, again, we also have been fed since birth. I wonder, though, in some ways, if maybe women can be a little bit more skeptical than men, especially young men that are getting thrown into this wellness industry now that maybe haven't had the since birth culture telling you you're wrong and this is how to fix it and buy this thing. Like men get less of that, and so they have less of the muscle built up to deal with that kind of thing. And now you see wellness influencers going squarely after men with information that is not science-based.
No, no.
Let's talk about what's a peptide, for example.
Yeah. Well, what is a peptide? And just to piggyback on what you're saying there, I'm really familiar with this. I have a 21-year-old son who's very into the wellness, really wants to be healthy, exercise. I mean, it's really easy to kind of get sucked into these YouTube videos. People are selling all kinds of solutions to help you stay buff, and yeah, I mean, it's difficult right now. And what we're seeing is, part of what's happening with the wellness and supplement industry and peptides, which we can talk about here, is there's really no regulation. So, if you want to create and go out and sell a drug, you need to test it. You've got to test it on humans. You have to test it again on humans. You have to prove that it works. And you don't have to do any of that with peptides. You don't have to do any of that with supplements. You can basically have a capsule, go out there and sell it, call it something, and say that it's in that capsule. And there's no regulation that you're going to buy or receive in the mail what they say is in that capsule. And there's no, proof that it works. And that's really the differentiator there. And I think we have to help, women and men really understand that, this is the case, and you need to be much more skeptical. You need to be looking for evidence. You need to be asking all those questions, and don't trust everything on the internet, right? It sounds like old advice, but you got to be really careful. And I think that fear is really selling right now. And particularly with all the mistrust that we're seeing in our public health organizations, in our government right now, in clinicians, it's really easy to sell fear right now. The other thing I think that's going on right now is kind of this whole culture of natural is better and nature is better, right? If Mother Nature makes it, it's good. If Mother Nature doesn't make it, it's bad. And there's been a lot of, we've grown up in this culture. It's been marketed to us over and over again that I myself, when I go into the grocery store and I see a brand that has a pretty little green stamp on it that says natural or organic, I also get sucked into that. And I think, oh, that must be better. It's natural. So all of these, things kind of coming together are drawing us to these wellness influencers and really causing us, a lot of people, I think, to make decisions that they wouldn't normally make.
Mm-hmm. Yeah, there is definitely a green halo around products that call themselves natural or organic, even if those terms don't mean anything. So anybody could be saying that. And I find it especially interesting. The the cyclospora outbreak with lettuce, that it turns out that one supplier, Taylor Farms, is supplying the lettuce to your Wendy's, your Taco Bell, also your Whole Foods, your Trader Joe's, that, different markets, different price points, different brands, like with different halos or not halos around them. And it's all the same thing underneath, which really makes you think about it.
Yeah, yeah. And that's a whole nother discussion we could have another day. But it is really, yeah, I mean, I think there's just a lot of information out there that's not accurate and is scaring people and doesn't necessarily need to. And a lot of fear around things that are not natural. I think there's kind of this idea that anything that's natural is good and anything that is synthetic is bad. And we have to just, that seems rational, but it's a fallacy. And it's a fallacy because it's not right. There's like plenty of natural things that are dangerous, right? Arsenic, like ricin, like lots of different things are dangerous that are natural. And there's a lot of things that are made synthetically that are really good for you. So we have to, first of all, kind of turn that off. That's not true. Even though, I have the same, I'm putting stuff on my garden, that I think is natural because I think it's a natural pesticide. But I also know in the back of my brain, it's still poisoning the same bugs. So it's the same end result. They're both killing bugs. And I wouldn't want to drink either one of those. So I think that it's really important to kind of check yourself and tell yourself, okay, wait a second, what am I thinking about here? And there's different things that you can kind of look for and test for to make sure you're not falling down that rabbit hole.
Exactly. Like smallpox is natural. Smallpox vaccine may not be natural. One is definitely better for you than the other.
Exactly.
So going back to the topic of that is hot in the news,
Peptide.
tell us, what is a peptide?
Well, it's not really clear exactly what a peptide is because there is no clear definition of what a peptide is. So if you're buying a peptide, you don't know what that is. So basically what happened last week is they are now allowing compounding pharmacies to create and compound peptides, but they're not being regulated. So again, you're not going to be really sure what you're buying there and what peptide you're buying and what exactly that means. So I think that we have to take all of this with a grain of salt. And just because a peptide is now accessible in a compounding pharmacy does not mean it's something you want to go out and get. It's still something that does not have scientific evidence supporting it.
So I really wish that there was more regulation and more science behind the health and wellness industry, behind supplements, because as you pointed out, like various consumer surveys have found that vitamins do not necessarily buy in a drugstore, do not necessarily contain the ingredients that they say they do, or at the, like there should be more regulation here to make sure that what you're buying is what you expect it to be, and there should be more research to show whether it does or does not do the things you want it to do. How can we make that happen?
Regulation? Well, first of all, you can write to RFK and tell them you want regulation of supplements. I think that, there's a lot of issues right now in terms of healthcare policy that, you have talked about for months and months and months. And regulation is something that happens at the federal level as far as drugs go and supplements go. And that's something that I think not a lot of policy is happening right now around that, which means that it's not something that I personally would go out and purchase. The other thing I think that's really important is, looking for scientific evidence or backing. There are still studies that are studying these things. You can still look up in journals and see, what does it say about this vitamin or that vitamin? How does it help with measles or not help with measles? So there's still lots of science going on in the world, and that's something that you still have access to. But as far as, actual proof, that supplements work, there is some data around some things, but you need to be really careful what you're buying. Supplements, you talk about the $6 trillion wellness industry, supplements are 180 billion of that and growing significantly. And it's a really easy thing to sell on the internet. And that's part of the reason it's growing so well. And it's not just the people who are selling it, but they are incentivizing others to sell it for them. So, I knew I was coming on the show today, so I looked at our inbox today just to see. And today we have 3 or 4 new emails from supplement organizations telling us we will pay you, X amount of dollars if you go and put this ad out about our supplement. So it's very easy money for people who don't have any concern about what they're selling or want to make easy money to promote other products where there's no proof that they work. So it's not it's you have to be very skeptical about, I think, the whole industry and buying from it. And I understand, I get it, that we want simple solutions. Everybody wants to take a magic pill. But unfortunately, the proof isn't there yet. And I would be very skeptical about where you spend your money.
So if somebody on the internet says this is an amazing pill or drug or a vitamin that will change your world, how can you evaluate that claim and that influencer to figure out if they're trustworthy?
We tell people to look for a few different things. First of all, is this person trying to scare me? Or sell me, right? And if either of those two are correct, that's a big red flag, right? Are you being offered kind of a simple fix for a really serious disease or condition? I mean, there are lots of people that are looking for a simple fix where there is none. And that is the other place we see that. So that would be another red flag. I think the other thing is, where did this information come from? Getting paid to promote this out there? Is there a study behind it? And you have to be careful about studies nowadays, because it's very easy to have a study that doesn't exist, or a link to a study that doesn't exist. And this is something that, we're dealing with AI right now. So you always want to check studies. If there's only one study that shows this, then that's something to look out for as well. If you've got 50 or 60 studies that says the measles, MMR vaccine works, that's one thing. If you have one study that says it doesn't, that's something to be very skeptical about. The other thing that you hear a lot is people don't want you to know this, right? And that's kind of the, here, let me tell you what I know. It's just a secret that I'm going to share with you. The doctors don't want you to know this. The pharma companies don't want you to know this. It's the whole idea that somebody's trying to get one over on you. And that's something else. And then also, just with all of the AI right now, you have to be really careful. There are basically AI farms that are generating videos right now for supplements. They are not real people or real influencers that they're showing. They're AI generated people. A lot of times they look good. They look like somebody that they want you to imagine, looks like your Uncle John or your Aunt Sarah. And they're really playing on your fears and kind of playing on the projections that you might have about the type of person you would want to have giving you that solution. So you've got to be really careful with that.
Mm-hmm. And finally, where should or could people go for science-based health and wellness information?
I would say Unbiased Science. We have written about this extensively, about supplements. We've got all kinds of great data on pretty much every vitamin or supplement or myth that's out there right now. So that would be unbiasedscience.com. The great tool, Georgie. You can ask Georgie anything, and she will give you the answer with science-based information. So I encourage you to do that. You can also go to PubMed. PubMed's really easy to get to. You can put a question in there and look it up and see what you can find there.
Great. And thank you very much for joining us.
Thanks, Laura.
And a reminder to our audience that we have free or low-cost healthcare resources available on our website at healthcarevoices.org/care talk. So check it out. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. And now, welcome to Louise Norris, health insurance and healthcare reform analyst at healthinsurance.org, and Diane Archer, the founder and president of Just Care. So let's start with Diane, because there's news that just came out of the Trump administration this week about prescription drugs.
Yes, big news for people with Medicare who have Part D prescription drug coverage. That coverage is expensive already for many people. And the price, the good news with that coverage, however, is that there is now a $2,100 out-of-pocket cap for your drugs. So if you're a high drug user, you will never have to spend more than $2,100. So long as you get your drugs through your Part D plan. That said, now the premiums for those Part D plans are likely to go up. Dr. Oz, who is in charge of Medicare, says that they won't go up more than about $120 a year or $10 a month, although others are suggesting that they could go up a lot higher than that. We will know for sure in September. But bottom line is the Trump administration is eliminating subsidies that the Biden administration put in place to help people with the cost of their Part D premiums. Here, I just want to add two things for people who use a lot of drugs and may not want to use their Part D coverage or may not have Part D coverage. And that is that they can go to pharmacychecker.org to find out about low-cost drugs around the world and save between 60 to 70% on many of their drugs. It's really valuable. The other thing I've learned through people who write into Just Care, my blog, is that sometimes if you do mail order drugs, you'll find that the full cost of your drugs at a Costco mail order are less than the copay for your drug on a Part D plan. So just beware that sometimes your Part D prescription drug coverage may not be the least expensive way for you to get your drugs.
Thank you, Diane. And Louise, can you tell us more about how open enrollment schedule may be changing, may not be changing? What's going on?
Yes, so we started talking about this over a year ago when CMS put out a new rule back in the summer of 2025 that was calling for a shorter open enrollment period starting this fall. That got challenged in court last year. And in June of this year, a judge vacated that rule change, basically said, can't do it. We're going to keep the open enrollments the same dates we had in the past. So ending January 15th in most states, but state-run marketplaces have a little leeway there. So after that happened, several of the state-run marketplaces officially announced that they were reverting back to their old schedule, with open enrollment continuing either until mid-January or even the end of January. But a few weeks later, just a couple of weeks ago now, HHS filed an appeal. So this has been going on now for over a year, and at the end of the day, now we still don't know what the open enrollment schedule is going to look like for this fall. So presumably the judge will rule on this appeal before open enrollment. So we should know either open enrollment will end December 15th in most states and by December 31st in all states, or it will go until January 15th in most states. And some states might even go or will go past that into the end of January. The key point, I think, for consumers is December 15th should still be your sort of mental deadline no matter what, because that's going to be your deadline in almost every state to get a plan that starts January 1, and you really want full year coverage. So stay tuned. We'll keep updating this. It's an ongoing situation, but plan to enroll. If you need to buy your own coverage, plan to enroll by December 15th.
Thank you, Louise. And then we have a question from Peony PXL on Reddit, who says that they recently had emergency surgery, then had to visit the ER 2 weeks later, and now they're getting inundated with all this paperwork from the first hospital bill saying that they owe $60,000, feeling completely overwhelmed. So Peony thinks they have insurance with an out-of-pocket maximum of $5,000 and then a secondary that should cover $3,000 of that out-of-pocket maximum. But they have this more than $60,000 bill or bills to deal with. So what's going on and what do they need to do?
Yes, so this is, especially if you're not used to this, if this is your first time with significant medical bills, this can be really overwhelming. But the hospital and your health plan have people who can help you navigate this. So if you're getting a bill from the hospital for $60,000 and this was an emergency situation, it sounds like perhaps the hospital didn't get your insurance information. It can happen, you know, it was an emergency, you went in, maybe they just didn't get your information on file. So they may not know that you have this insurance that should be limiting your out-of-pocket significantly. So that's the first thing I would do, is contact the hospital billing department and make sure that they have both of those health plan information on file and that they have submitted the claim to both of them. If they have, and maybe they haven't heard back, or the health plans haven't processed the claims, then your next step, once you know for sure that the hospital has filed the claims with the health plans, then your next step is to call those health plans, your primary and your secondary, and make sure they've received the claim, make sure that it's being processed, that there aren't any glitches or errors or holdups in this whole thing. Ultimately, you should wait until you get an explanation of benefits from your health plans and make sure that what it says on that that it's called an EOB, explanation of benefits, it'll say on there how much you owe. And then you want to look at the bill you get from the hospital and the doctors there and make sure that it matches. If it doesn't match, you keep calling. You call the hospital billing department, you call the health plans. Once the bill that you're getting matches what the health plan says you owe, then you go ahead and pay that bill. And sometimes this can take a while. So if the hospital is hounding you to pay a bill and you haven't got a clear EOB yet, you can contact the hospital and explain what's happening and ask them to hold off on sending anything to collections. They will, they're used to this, they know how insurance billing works, but you do just want to make sure everything matches before you actually pay any bills.
Thanks, Louise. And to answer the question that we never quite got around to answering, Jen, are you still here?
I am still here, actually. And I just, we never got to that. So peptides are kind of these short little chains. They're amino acids, and your body actually does create them, but you can actually also create them in a lab. So what we're seeing right now are these peptides that are being used for all kinds of things like skincare or to get more energy, or so there's different options and different ways to get them. Again, it's a whole, is it better if it's naturally made or if it's made in a lab? So those are peptides.
Yes. And GLP-1s, the P is peptide?
Yeah. So that's a whole nother conversation though, Laura. We're not going to talk about GLP-1s today.
Okay. So that's another conversation, but that is a peptide.
Yes.
Okay. All right.
So peptides, your body can make them naturally. So like insulin's a peptide, endorphins are peptides. Those are all things that your body makes.
Okay. Thank you very much. And with that, thank you everybody for joining us today to learn more about healthcare policy, patients' rights, the fight for a just healthcare system, and answers to your questions on health insurance and healthcare. Be sure to check out more free or low-cost healthcare resources on our website at healthcarevoices.org/caretalk. please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more. And be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.